Hello, and thank you for attending Return to Play training. My name is Mary Hess, and I'm the Director of Health and Wellness for Fort Wayne Community Schools. I just want to say up front that facts and best practices for preventing the spread of COVID-19 change frequently. The information you are getting today could change at any time. Please remember to listen to the health experts and watch closely for district communications to make sure you are up to date. The goal here is for everyone at FWCS to be as safe as possible. I'd like to begin by sharing a question I get frequently about COVID-19, and that is why. Why is this worse than the flu and other viruses that we experience? Why do we have to endure all of these changes to our daily routines? The answer is this is a novel or new virus. It has not been seen before December 2019 when it showed up in Wuhan, China. We also don't have great ways to prevent it. There is no vaccine yet for COVID-19, and herd immunity isn't built up. Herd immunity is when many people have been exposed to a virus and have antibodies to prevent the disease. Think about measles and chickenpox. The majority of people in the United States have had these diseases or have been immunized against them, which means we don't have to worry about most people getting them. With COVID-19, everyone is vulnerable at the same time. With COVID-19, more people get sick enough to require hospital care than we see with the flu. And it's also more infectious than flu, and it has a higher death rate. In a normal year, we see 40 to 60,000 deaths attributed to flu each year in the United States. Flu season usually lasts 5 to 6 months. We have had 125,000 COVID-related deaths in the United States since March. That gives you a picture of how big and how fast this virus is spreading. So let's talk a little bit about how COVID-19 is spread. COVID-19 is a virus that is spread by riding on the droplets that you expel when you talk, breathe, cough, sneeze, sing. Knowing this can help you understand why masks and face coverings might help prevent the spread. It covers your mouth and nose, preventing the droplets from reaching others. Masks help, but they're not foolproof. Some droplets can still escape and linger in the air as a fine mist, which is why you hear so much about the importance of staying at least 6 feet away from others. In time, those droplets fall out of the air and land on surfaces where they can live for a long time. When others touch those surfaces, they can become infected, which is why it is so important to wash your hands frequently and disinfect surfaces before and after use. I'd like you to keep this in mind. The strategies we are about to discuss are about protecting you, but they're also about protecting others. It is very difficult to give a clear message about a disease when 40% of the cases may have mild symptoms or no symptoms at all, while others could have serious illness, hospitalization, and even death. You may feel brave because you're young and strong and have a great immune system. Others may not have that. You could infect a friend, a team member, who then takes it on to a family member who's vulnerable. We need to function as a team and protect each other. So exactly how are we going to fight this disease and keep each other well? Let's start at the beginning with self-screening. This is something we must all do every day before we come to work, practice, or school. Self-screening just means you check in with yourself and you make a conscious effort to be sure you don't have any of the following symptoms. You're looking for a fever over 100.4 degrees. You may feel awful, your cheeks will be flushed, you have chills, cough, shortness of breath, unexplained fatigue, muscle or body aches, unexplained headache, a new loss of taste or smell, a sore throat, congestion and runny nose, diarrhea, nausea, or vomiting. I know that's a really long list, but any one of these symptoms could mean that you have COVID-19. So we really need to stress the importance of staying home when you have any of them. This sounds really easy, but it's really hard. You know, you heard me read the list. This is a long and very common list of symptoms. You may feel like you're being wimpy or irresponsible if you stay home for these, but really it's the exact opposite. You are actually being more responsible because you are trying to prevent the spread of a virus that could really hurt someone. The message is, if you are sick, please stay home. Let's take this one step further. We are also asking you to report any positive or presumptive COVID-19 case for any of your close contacts. A presumptive COVID-19 case is when someone is sick enough to go to the doctor does a COVID-19 test, and now we're waiting for results. A positive test is someone that's already had their test come back positive. A close contact is anyone living in your house or anyone you spend a lot of time with. The rule for close contact is someone closer than 6 feet for longer than 15 minutes. So we're talking family members, friends, your boyfriend, your girlfriend, the guy who sat next to you on the couch while you played video games, all of these close contacts. If they are sick and have a COVID-19 diagnosis, you also should stay home and notify your supervisor or coach. This is despite the fact that you're probably having no symptoms at all. Someone will follow up with you on the next steps you need to take. Once you have been sick, there will also be new processes for returning to practice and play. These are much stricter and much more complicated than any of us are used to, but they're important if we're going to prevent the spread of COVID-19 to your team and to your school community. Do not just return to practice or school because you feel better. In most cases, you can expect to stay home a minimum of 10 days before you can return, and at least the last 3 of those days you must be free of fever without using Tylenol or other fever-reducing drugs. There could be exceptions to this. If you visit your physician and they confirm you have some other illness, in that case you would need a note from the doctor releasing you to return and also have at least 72 hours with no symptoms of illness. I've been asked frequently if a negative test would allow someone to return earlier than the 10 days. The answer to that is maybe. There are some local free testing sites in our community. You can find an up-to-date map for locations for testing on the Indiana State Department of Health's website. This is frequently changed and updated. To return earlier than the 10 days without a doctor's note, you must have 2 negative tests spaced at least 24 hours apart and be free of symptoms of illness for at least 72 hours. I know you will never remember all of this. I wouldn't expect you to. But it's why coaches need to email me or call the FWCS COVID-19 hotline at 467-1907 when they have a student out for illness. One of our nurses will get back to you and help guide you through this process. So what can we expect if someone is a confirmed case of COVID? When there is a confirmed case of COVID-19, this is what you can expect. The Allen County Department of Health and/or the Indiana State Department of Health will guide us through a case investigation. You can expect that anyone who has been closer than 6 feet for longer than 15 minutes, up to 2 days before that person got sick, will be required to stay home and quarantine for 14 days. Quarantine just means that you stay at home and away from others. That 14-day period starts from the last time they had contact with the infected person. That is why it's so important for coaches to keep good records of who's present at a practice. Keep those kids together in consistent cohort groups. Keep seating charts when it comes time to ride buses, when you're ready to compete. And generally think hard about how your group interacts each day. When you don't have a good answer to any of these questions, the quarantine group gets larger. Following the guidelines you've been given will minimize those at risk and keep that quarantine group as small as possible. This means you have more players who can continue to practice and play. Okay, Let's review the mitigation strategies we discussed to help keep COVID spread limited. The better we are at this, the less potential we have to spread the disease. Number 1, use social distancing. Think about doing things differently. Just because larger groups are allowable does not mean it is wise. Keep people at least 6 feet apart as much as possible. When you can't, keep kids in those cohort groups and keep track of who's been together. When there is a case, it could mean the difference between a quarantine for a small group and losing your entire team for 14 days. Number 2, let's talk about masks and face coverings. Remember, I wear my mask for you, you wear your mask for me. Masks protect you a little, but they protect those around you much more. Staff must wear masks at all times, and students should wear them unless participating in strenuous activity where a mask could cause problems with breathing. Let's be team players and look out for each other. I'd like you to watch this brief video on how to wear your mask safely.
In this video, we're going to go over mask wearing, how to wear it properly, how not to wear it, and how to take it off. So with the mask, you're going to make sure that your hands are clean. So either you've just washed them or you've just used hand sanitizer. You're going to take your mask, whether it's store-bought or handmade. You're going to grasp it by the earpieces. You're going to put it across your face. You want to make sure that when you put the mask on, that it's tight around your nose, pulled underneath your chin, and tight around your ears. If it's not tight enough back here, you can always take this, twist it, and pull it just a tad bit snugger. When you're wearing a mask, it is important not to touch your face. You want to keep your hands away from your face. You don't want to be touching any part of the mask because that could be contaminated. If you would touch it, you're going to need to wash your hands with soap and water, or you're going to need to use that hand sanitizer. When you're wearing a mask, you don't want to wear it under your nose. You definitely don't just want it as a decoration under your chin and hanging off of your ear. None of those will work for you. So when you're wearing your mask, again, tight around the nose, under the chin, tight around the ears, and don't touch the mask. When you go to remove the mask, you're going to grasp it back by the ears. You're going to pull it off that way. If it's disposable, throw it in the trash. If it is handmade and needs to be laundered, you want to wear your mask one day and then launder it so that it's clean for the next day.
Okay, let's talk about number 3. Number 3 is about hand washing and hand sanitizers. Wash your hands frequently with soap and water for at least 20 seconds or use a hand sanitizer with at least 60% alcohol content. Use that clean hands in, clean hands out motto when you're entering a training area. Don't touch your face or your mask with your dirty hands. People don't always wash their hands well enough to prevent the spread of germs. Let's watch this second brief video so we can see how to do it properly.
We're going to talk today about how to properly wash your hands. So the first thing you would need to do, turn on the water, get them nice and wet. You're going to put soap on your hands, and then you're going to want to scrub with soap for at least 20 seconds. Or with young kids, you can tell them to sing the ABCs. But when you are scrubbing your hands, you want to make sure that the soap really gets lathered. You're going to want to go in between your fingers as well as your fingernails. And I even like to go as far up as my wrist when I'm washing my hands. And you'll be counting to 20 in your head. Once you're finished washing your hands, what you will want to do is rinse them off with water. If you are able, grab paper towel to dry your hands off first before turning off the water. You will use the paper towel to shut off the faucet.
Okay, let's talk about step number 4. And step number 4 is about disinfection. It's important to wipe down your environment and any equipment before you start and after you use it. I know I gave you a lot of information quickly, and you still may have questions on what you learned today. If so, please write them down and turn them into your meeting organizer, or use the COVID-19 dialog box on Let's Talk. We will collect them and provide answers in a future FAQ. If you have an urgent question or you need to report a case of COVID, please call the COVID-19 hotline at FWCS. That number is 467-1907. We will get back to you as quickly as possible. Thank you for your time and attention today. We know our students need all the benefits that school, athletics, and extracurricular activities bring, but we want to do this safely. It is our sincere wish that you have a successful and safe opening.